Federal Drive is presented by GEHA, Government Employees Health Association, proudly providing health and dental benefits to federal employees and their families. Visit GEHA.com.
The Department of Health and Human Services is centralizing the processing of reasonable accommodation requests from its employees. As a result, it's facing a months-long backlog. HHS employees say the department is making it harder for employees with disabilities to receive telework as a reasonable accommodation as the Trump administration enforces a return to office mandate. For more on this, I'm joined by Federal News Network's Jory Heckman. Jory, thanks for being here.
Hey, Terry. Great to be here.
So tell us what changes HHS has already made to its reasonable accommodation process.
Yeah, so the first one here is a matter of how these accommodation requests are being handled. We saw an internal memo where the Department of Health and Human Services, for all its component agencies, it is taking over that process. System at the Centers for Disease Control and Prevention, its accommodation tracking system has been shut down, and all of that is now moving over to HHS, the main department. And as a result, the HHS is taking on a backlog of about 3,300 reasonable accommodation requests from CDC. And it's unclear how long each individual case is going to take to process, but in the aggregate here, HHS is expecting this is going to take about 6 to 8 months for HHS to clear that backlog of those thousands of cases that they have now inherited.
What other changes are still in development, and what does this mean for folks who are caught in limbo in this transition process?
So we've seen in this memo, and I've heard from HHS employees that the department is working on a new reasonable accommodation policy. We haven't seen that come out just yet, but according to what I've heard from folks, it says that HHS employees would be given about 80 hours of telework that they would be allowed to use in a given year, and that there would be a finite amount that they'd be able to draw from, that they would be able to use that for reasonable accommodations or just for their own personal use, not connected to a reasonable accommodation, and that they would also not allow telework as an interim accommodation while the department is processing a reasonable accommodation request. So these are pretty substantial changes because reasonable accommodations are just that. They're accommodations that are legally required on behalf of agencies for employees that have disabilities and are asking for adjustments to work processes, equipment, hardware in some cases, or just changes to process or things like telework to ensure that they are able to do their work as productively as possible and as comfortably as possible.
Well, you mentioned a lot of other forms of accommodation. Does this policy only apply to folks who had remote work as a reasonable accommodation? There are folks who just have technology assistance or some other things. Is it the whole suite of reasonable accommodations that's being affected here?
Yeah, so what I've been told by employees at CDC, at HHS, from what they've gathered from this policy, they say that employees, that regular scheduled telework, so periodic, once or twice a day per pay period, for example, and full-time telework, those are no longer options for reasonable accommodations. That's what we've seen, and we'll see the policy come out sooner rather than later, but those are the details that have been shared up until this point.
Has the agency said anything particular about the policy?
I've spoken to some spokespersons for both HHS and CDC. They say that this policy aligns with the Trump administration's executive order on returning federal employees back to the office and ensuring that the agency is in the best position to serve the American public. And as far as the centralization goes, they say that that's going to be a more efficient way to process those reasonable accommodation requests.
Have the union said anything about the policy and what they plan to do?
Yeah, so AFGE, the American Federation of Government Employees, Local 2883, they represent CDC employees who work in the Atlanta headquarters, and they told staff recently that this policy was communicated to employees their first day back from the government shutdown, the longest shutdown on record, which ended last month, back in November. When they came back, CDC employees were told that supervisors no longer have the authority to approve temporary 90-day agreements for full-time telework. and that temporary accommodations that had expired over the shutdown could no longer be renewed. And so some people were told that their non-expired reasonable accommodations were being canceled, and this was a big change that was communicated rather suddenly. And the union says that this is actually in violation of the Trump administration's return to office mandate because there was guidance handed down from the Office of Management and Budget and the Office of Personnel Management saying that, look, you still got to follow the law when it comes to reasonable accommodations. That for everyone else, return to office does mean 5 days a week, but there are, of course, going to be exceptions to that policy. But what we've heard from spokespersons at these agencies is that they are doing everything that they are doing in compliance with the law.
You've mentioned CDC specifically. Are there any other portions of HHS that are following this similar sort of policy?
So there's a notable departure from all of this. The Centers for Medicare and Medicaid Services, they are going their own way more broadly for telework, not necessarily connected to reasonable accommodations, but just a workplace flexibility policy that Administrator Mehmet Oz is rolling out in recognition of the hard work that employees have put in this year. This is everything that he's communicated to employees in an email that I obtained. This is going to be telework is going to be allowed for employees based on their most recent performance evaluation. If they score the highest score possible, 4.5 or higher, employees will be able to take 2 telework days per 2-week pay period. And for somewhat lower scores, but still good scores, they would be able to take 1 telework day per pay period. This is a new policy that recently went into effect, and email states that this doesn't count toward the 80 hours of telework that HHS is rolling out for all of its employees.
This sounds like it could be really confusing for folks in HHS. So any insight as to when this might get sorted out or when there will be an official statement?
Yeah, so we're expecting this HHS policy to be rolled out later this week. As you can imagine, though, unions are very upset about all of this to the extent that they are able to still, raise a complaint about this, even when a lot of these unions are no longer being recognized by the agencies. And you can well imagine that lawmakers may get involved as well, because this is a substantial change to the process as we've known it, and that there are folks who have disabilities who may feel that they are no longer able to fully do their jobs given substantial changes happening rather quickly.
That's Federal News Network's Jory Heckman. Jory, thanks for bringing us this story, and we'll certainly encourage folks to stay tuned.
Thanks, Terry.
You can find his story at federalnewsnetwork.com.